right, thanks everybody for joining us today. So some things that we're going to go over, we're going to share the data release schedule, some work MDC's been doing around reducing the data lag, and some things that we could ask you to do to be helpful around the data matching or patient matching for us for the data. We want to take a look at our quarterly reports that we're going to be doing for the performance measure to get your feedback on those. If you think these are going to work for you, or if you have suggestions to change them to be more useful before we get these out to you. I want to talk about the fall regional meetings, some VBR reminders for those of you with new practices, and some updates on some specialist work, both the clinical champion meetings, new sites that have joined, and our thoughts on performance measures for those groups. Also, before we get started, I'm going to put in this sign-in link in the chat. So this helps our team, since we give credit, and track your attendance on these. This helps us to match up who is attending the meeting and who shows up on our Zoom reports, because it's not always a one-to-one. So if you could sign in, that would be incredibly helpful for our team in matching attendance with your PO. Okay, so we know one of the main challenges that you have with the data that we get from MDC that comes up really frequently is the data lag and wanting it to be shorter, and so that we can get you more useful, more actionable data. So we, with our work with MDC, have asked them to really prioritize this as one of kind of our top priorities within MCT2D. And the work that we're asking them to do. So to address this, MDC had like a continuous improvement event that they hosted to look at the data lag and how they could possibly reduce that. They've found a lot of different opportunities that they were able to sort into 3 different categories. So one was looking at the data volume. So if they could archive older data, they could reduce like their data processing time. They also looked at their hardware and platform architecture. So seeing where they can address constraints there that also slow down the process or introduce limitations to it. And then looking at validation and testing. So if they can automatically validate the incoming data files and test some of these different components before putting them in the data mart, this reduces downstream issues in testing time. So it would allow us to test earlier as well and get the information to you sooner. So those are the 3 main areas that they're going to be working to address. They're going to reconvene again this month to come up with different ways to address issues in each of these categories and hopefully reduce that data lag. So this is our 2025 release schedule that we'll share these slides with you after the meeting so that you'll be able to reference it as well. So like the data release schedules that we've done in the past, we always have 8 data releases throughout the year. And on the next slide, we'll show you some of the improvements that they're making in these data release timeframes. So based on the work that they're planning to do and address through those 3 categories that we talked about before, MDC is aiming to reduce the data lag at release 15.5 days. So the average in 2024 for both claims and clinical data was 74.4 days. In 2025, they're looking to have that down to 58.9. And the lag at next release means how old, like the oldest data was from the last release, essentially. So that's going to be reduced as well by 11.6 days from 118 to 107 for both clinical and claims data. We're hoping to see these go down even a little bit more. It's my understanding that these are like conservative estimates, but we will see. That'll be based on the work that they're able to do through their following the farther planning meeting they're having in November. But still, this is a step in a good direction where we're, getting data almost 2 weeks quicker than we were in the past. Again, I know it's not like the perfect ideal, but we'll continue to work towards reducing that data lag with them, but good step in the right direction. One of the issues that we talked about was around like the data matching and the challenges that we have with this. You saw this last year when we set as a PO scorecard requirement, the aim for you to kind of increase the quartile of like patients that you had A1C and BMI data for. We ultimately had to not hold you accountable to that measure because one of the biggest challenges was around patient matching. But we do need your help like moving forward with improving the data matching. So when you submit data to MyHIN, if you can ensure that the data includes these fields when submitting, so the patient first, last name, and date of birth, and then as many of these additional identifiers that you can include. So their zip code, the last four of their social security number, their insurance contract number, that really helps MDC be able to match like the patients correctly across like all the different data sources that they have, which will like, take us in the right direction of reducing the data lag and also just giving you more data in your dashboard to work with as well. Questions or comments on anything related to the data before we move on to discussing our quarterly reports? So we are going to be distributing quarterly reports like we've done in the past. They're going to focus primarily on the performance measure that we've introduced around A1C. So prior to us generating and distributing these reports, we wanted to show you what we were planning to include in these so that you could say like, yes, this is useful. This is what I would be hoping to see in these reports, or no, could you please include this, or could you do this differently, etc. So I'm going to walk you through how we're planning to create these, and then I want to pause and get your feedback on if this is useful and actionable to you. So we plan on creating one of these reports at the PO level. So you'll just have some reminder information at the top. That shouldn't be anything new, just reminding you of the eligible population, what the definition of the measurement was, and what the goal rates that we're aiming for with the performance measure is. And then you'll have all of your practices listed. In this example, we just have one practice that's measured independently, and then 3 practices that are measured in an aggregate group. So from the very first page, just a really quick reference and summary, you'll be able to see, no, they're not meeting it if it's in red, and green, they are meeting it if it's in green. And then the page number, like where you can go and look for that practices, like specific details on how they're performing. So you'll see all the practice names listed out here for the aggregate group, but just one dot, of course, since they're all being measured together. So then for each individual practice, you just look at the picture on the left right now, we're going to have the number of patients in the baseline population, how many patients dropped out of that baseline population, like between when the year started and now. So that could be that they passed away, they're attributed to a physician now in another practice, any number of those reasons. So you can see here, like, okay, they started with 69 patients from Medicare, 6 dropped out, and now 63 of those patients are still being measured in the denominator. And then that final number that corresponds like to these meeting the performance measure, yes or no, they're at 85.7%. Our goal rate is 87%. So you can see that they're not meeting it. For commercial, they are, because our goal rate is 70%. And then these graphs, this one is meant to show you how many patients have gotten an A1C recorded after the baseline A1C. So let's say we distribute this report December 1st, hypothetically, it would be any patient who has received an A1C from June 1st of this year to December 1st of this year. So this is saying of those 63 patients that are still in the denominator, 8 have received an A1C and 55 haven't received an A1C yet, so that you're able to kind of see how the data has been updated. We also down here will have broken down into Medicare and commercial, the performance rates over time. So what percentages are both at baseline in first quarter. This one shows the second quarter as well. And then what that average A1C value across all of the patients in that denominator are over time. So you can see like with those additional patients that got an A1C, that it went up a little bit from baseline and now ultimately down. Again, just an example. So you'll have this for all of your individual practices, and you'll also have this same page, just one for your aggregated group practices as well that are being measured together. So this would say, instead of practice 1, like aggregated group, and you'd have the same information. It would be the completed denominator summed across all of those practices, any that had dropped out, this would be reflective of like the combined practices page that you had in your, or tab that you had in your baseline performance data. And then in addition to this page, that's a summary of all of the patient information. We're planning to include for the aggregated practices, this second page on their report that has it broken out. Now, this would technically be in this example, not this same practice one. It would be practice 2, 3, and 4, only those that are measured in the aggregated group. But it will show like, okay, this is this group's rate. So you can see, all right, of my aggregated practices, this one is the one that's not meeting the measure for Medicare, and none of them are meeting it for commercial. And this is kind of where they fall across those. So I'm going to pause, and I really appreciate any feedback that you want to share about these reports, that either unmuting yourself or putting in the chat. Like, is this helpful to you? Is this the information that, you know, you'll be able to easily take back, disseminate to your practices? Is it clear? Does it give you the information that you want and need as we're in this performance year? Mm-hmm. Because this is your opportunity to make any requested changes to it. If not, this is exactly the reports that you'll be getting. So Susan asked, will we be able to see patient names? So we weren't going to include patient names as part of these reports just because it's going to result in incredibly long reports, because for each of these we have to list. What would you be looking for, Susan? Like those that are not meeting the measure essentially, or those that had like gotten their A1Cs taken? Like what would be the most helpful for you? Sorry, I accidentally advanced the slide.
I would, the practices would ask specific patients that have not met the measure yet.
Okay. Yeah, see, our concern for doing that was just how long these reports would be, because even right now, let's say you have 14 practices participating, this is going to be like a 17-page report regardless. Is that something that everyone sees or thinks would be really, really helpful to include and necessary to include? Carrie asks that info is on the dashboard pages. So yes, you can go into the patient data dashboard and you can search like patients with an A. You could do patients with the A1C over 8 or patients with the A1C over 9 and get a list of patients that are in the dashboard. So that is like what our suggestion would be to look for it there as well.
Okay, thank you. Otherwise, I think the report is great.
Okay, thanks so much. Appreciate it. Yeah, that's a good point, Mindy, that it could be like a HIPAA concern for those aggregated ones as well. So we'll likely, you know, for this time, go with directing you like to the dashboard to look at like who is over and under on that. We could explicitly include like directions for how to do that in the report, just so that it's easy to reference there on like how you'd filter it and everything else. Jake, you can export like the patient names from the dashboard, correct? If they were to do that, like if they were to set a filter to look at everyone with an A1C over 9, there's an exportability to that search, right?
Yep, absolutely. So that's the button in the bottom right-hand corner if you use the legacy dashboard and to do the patient list filtering. The button in the bottom right-hand corner that's a square with an arrow pointing down in it. And then you'll just want to make sure you select CSV, and that'll export your list of patients that you filtered so that you can distribute that. And you can organize that by practice so that you could send to practice their list of patients as well.
Perfect, thank you. So what we'll do, like in response to what everyone's saying around this, so up at this section, we'll include like another information of pulling additional data from the dashboard. We'll tell you exactly how to filter it to look at Medicare patients, how to filter it to look at commercial patients, and we can put what Jake just said about exporting it there as well and how to export it. So we'll include either here or on the last page that of the report that has some additional documentation of exactly how you can go about doing that. Great. Well, thanks everyone so much for sharing that. And of course, we're always open to our feedback or your feedback. So once we create these initial reports and send them out, if you have feedback between these first ones we send and the next quarterly reports, let us know and we'll try to incorporate that into there for you. So really helpful to hear all your thoughts on that. Thank you. Okay. And then just wanted to show the work that we're doing on the summary measures landing page for the dashboard. So this is, we'll have your performance measure that we're working on integrating the baseline population for. So ultimately right now you're able to see all of your patients, whether or not they're included in the baseline or not. And now in the future, we're going to have it so that you can narrow down to the performance measure population so that you can see what your rates are overall on that as well. So we're going to be launching that in December too, so that you'll be able to track that both on the dashboards and also in the quarterly reports that we're sending out. Okay. Now on to just some general collaborative updates. So our final virtual regional meeting is taking place this week, Thursday, the 14th at 6 p.m. So this would be a good opportunity to make sure that your clinical champions have attended one of the other 3 meetings. There has been, because of course they're virtual and there's not the need to drive anywhere, more kind of jumping around between different meetings. So just to let everyone know that to make absolute sure that if you think they've attended one of the past ones, that you check it on the portal and make sure that's the case. And if not, giving a reminder to your clinical champions that their last opportunity to attend these meetings and get credit is this Thursday. Again, they can send a substitute who's another clinician. If they aren't able to do that, they'll get a regional meeting strike, but they'll be able to watch a recording and take a quiz about it afterwards so that they can still meet their VBR credit for. After 3 strikes from regional meeting attendance, they won't be eligible to earn VBR for participation in MCT2D following that. So again, make sure everyone's attended. And then for the POs who have new practices, in just about a month, we have 3 deadlines for those new sites. So the physician level survey, that's just really short, 11 questions about things like their familiarity and comfort with the medications and with CGMs. We need, in order to earn the full points on the scorecard for that, 90% of physicians in the practices need to have completed that. And then there's, lesser points if fewer physicians complete it. Have to complete all 4 of the MCT2D training sessions. So Jake just sent out an email on Friday that has a link to the Beaumont CME for all of the 4 trainings. If someone has completed 2 of the 4, 3 of the 4, that task is going to still show up as not met. And you can see on the individual practice scorecard, which trainings have been attended and which ones still need to be completed. And then the last piece of this is just so you're aware, if someone completes it via the Beaumont website right now, which is the way that they earn CME for it, we don't get that in real time. So after our ones that we offered via Zoom, we uploaded the registration a day or 2 later. But with Beaumont, we're getting it from them every week. So it's going to just be a bit of a delay from when someone completes it to when you're seeing it updated in the portal. So just so you're aware. And then finally, the patient needs assessment, where we're asking you to collect 10 responses from patients per practice, the same due date of 12/13 with that. So we'll be continuing to send automated reminders via the portal. So you should get that information on there, and we'll let people know who hasn't completed it yet. Then just a reminder for specialists. So we're also having the specialist clinical champion meetings taking place this week and next. The nephrology meeting is virtual and is taking place on Wednesday. The virtual endocrinology one is taking place next Thursday, the 21st. Both of these are from 5:30 to 7. And then we had 2 new endocrinology practices join MCT2D, and they'll be starting at the beginning of next year, and no new nephrology practices joining for this cycle. Considering we launched our first performance measure for the primary care practices, we wanted to follow suit and do the same for the specialists as well. So for nephrology, we're considering a performance measure around urine albumin creatinine ratio testing for participating nephrologists. It will be more if a patient has received a test rather than the value of the test. And this is, to support the HEDIS metric around UACR. So that's what we are planning to launch. Also, as our considerations always are for this, we need to consider like the data that we have, what we're able to do for these measures, considering those constraints. And because we're able to get this information from claims, it was a good fit since that data is usually the most complete data we have. For endocrinology, we were looking at patients who have been prescribed a CGM, and then if there's been billing for the 95251 code for their interpretation. So that's following along with the thing that if someone's been prescribed a CGM, we want to make sure that they're getting the support and guidance around the use of that CGM from the endocrinologist who prescribed it. It also should be in the interest of the endocrinologist to make sure that they're billing this as well, so they aren't leaving money on the table with that. So that's likely what we're going to be doing in the endocrinology space. And that's all that we had. Does anybody have any questions about any of the topics that we covered, or any additional thoughts on the performance metrics or the quarterly reports that we shared? No? Okay. Just to share one more time in the chat, the sign-in sheet, that's really helpful for our team in being able to administratively match everyone up with the right POs on our end for tracking attendance. For us, our next PO calls are going to be Monday, December 9th, and then we moved the Wednesday one to December 18th because we have a conflict during that normal time. So just wanted to make everyone aware of that, and it should be changed on your calendar as well.